Welcome back. This should be a shorter video as we finish our discussion of contraceptive options with sterilization methods. Because APGO singled this topic out into its own learning objective, I thought it should have its own video. We will be covering the following APGO learning objectives. By the end of this video, you should be able to understand the basics of both sterilization procedures, the risks, benefits, and complications of these procedures. We will start with vasectomies. For people with penises, the only method of sterilization available is a vasectomy. This is a procedure in which the vas deferens is cut and tied off. This separates the epididymis, where sperm are stored, from the ejaculatory duct, where sperm is eventually ejaculated through the urethra. This procedure is outpatient and performed under general anesthesia, usually by a urologist. A vasectomy can be performed without a scalpel, which provides the benefit of not having stitches. With a vasectomy, semen is still produced and ejaculated, as the seminal vesicles and prostate secretions are not interrupted. A patient should return to clinic 3 months later to ensure no sperm are present in the ejaculate, as this is about how long it takes on average for sperm to clear the reproductive system. This procedure can be reversed by reanastomosis of the vas deferens with moderate success, with success rates improving with less time between the original procedure and the reversal. Some of the advantages of this method are that it is very safe, more than 99% effective, permanent, and requires virtually no maintenance after the 3-month visit, as well as being cost-effective and private from a partner. Some disadvantages are that it does not provide STD protection, does require an upfront clinic visit and a 3-month checkup, and could cause regret in those that undergo the procedure, as well as having some complications, which we'll talk about next. The most common complication is a hematoma, which is slightly less common in the no-scalpel version of the procedure. Other complications include infection, which is also less common in the no-scalpel version, and sperm granuloma, which is when sperm leaks out of the vas deferens and causes an inflammatory reaction that usually goes away by itself, but still can be painful. Swelling of the epididymis can also occur, as well as post-vasectomy pain syndrome. Failure of the procedure can occur in a number of ways, such as through a technical error, the rejoining of ligated ends of the vas deferens, or unprotected intercourse before checking for absence of sperm are all possible. Next, we'll talk about tubal ligation. For people with uteruses, there were 2 closely related methods of sterilization, tubal ligation and tubal implant. Tubal ligation involves cutting off and tying the fallopian tubes so that sperm cannot travel to the ovaries to fertilize an egg. Another form of permanent birth control that was previously used in the US was a tubal implant, which went by the brand name of Essure. This method involved a small coil being placed in the fallopian tubes, causing scar tissue to form, and physically blocking the tubes so sperm could not travel to the ovaries. This method is no longer on the market due to side effects and migration of the implant, but it is worth mentioning as you may encounter patients whose implant is still functional and in place. Tubal ligation is the preferred method of sterilization in the US and is effective immediately, unlike vasectomy. Tubal ligation is a fairly simple outpatient procedure performed under local or general anesthesia. Like a vasectomy, tubal ligation can be reversed, however, the success rates are much lower than in vasectomy and depend on the age of the patient and the length of the remaining healthy tubes. I wanted to make a quick note to talk about postpartum tubal ligation in general. This is a fantastic option for people who have just delivered a child and want permanent birth control immediately afterwards. For example, a person who is nearing the delivery of their 3rd child and is sure they do not want to be pregnant or have a child again may choose this option post-delivery. This is an ideal time for this type of contraception because the procedure is much easier postpartum than at other times. This can be done 2 different ways depending on the method of delivery. With a vaginal delivery, a procedure called a mini laparotomy is performed, in which a small incision is made in the abdomen. Postpartum is an ideal time for tubal ligation because the uterus and fallopian tubes are located just under the abdominal wall and are much easier to get to than a few hours to days later when the uterus and fallopian tubes move back into their normal location, much lower in the abdomen. With a cesarean delivery, tubal ligation can occur through the same incision used to deliver the baby. This is obviously much easier postpartum as the fallopian tubes are already exposed and can easily be ligated. Both procedures take about 30 minutes and have the same complications that you will find in tubal ligations in general, which will be discussed in a few slides. Advantages of this procedure include that it is safe and effective, has virtually no maintenance, can be private from a partner, and has few side effects. Disadvantages include lack of STD protection and some post-procedural risks and complications, which I'll talk about on the next slide. Some immediate complications post-procedure include bleeding from the fallopian tubes, injury to nearby structures, postoperative pain from the incision site or from the ischemic tubal tissue, and conversion to a laparotomy. Delayed complications include ectopic pregnancy, simply because it is more likely for an egg, if fertilized, to get stuck in the fallopian tubes as it would not be able to reach the uterus, as well as failure via recanalization of the fallopian tubes. Thanks so much for listening. The next video will be discussing reasons why some people are not able to access the contraceptive methods of their choice or contraception in general.